Health experts are urging people who traveled during the Easter period to pay attention to any flu-like symptoms they may experience over the next few days, which could signal a coronavirus infection. Thousands of people have flocked back home after spending time at various holiday destinations over the weekend. Now, let's discuss this further. And we're joined via Zoom by epidemiologist Dr. Joe Barnes. Good afternoon to you and welcome.
Good afternoon.
Are we likely to see a spike in cases following the Easter weekend?
I think it's unlikely that we will be so lucky as to escape that. The only thing that we are not sure of is how high that wave is going to reach. And we are desperately trying to inspire the population to take proper precautions and pay attention to the requirements like masking and keeping a social distance, in the hope that we can help the already overburdened health services to cope with what is coming, because winter is coming, and during winter people stay indoors a lot more. It is cold and the distance between people shrink quite a bit. So we are expecting that with winter coming, it would have risen anyway. But the Easter weekend was, as far as the pandemic is concerned, unfortunately came at a very difficult time. People understandably need to see their family. They have social and emotional needs as well as health needs. And we are all concerned that the travel that has happened over the Easter weekend may spread the virus quite efficiently.
So what's your assessment of the alert level of ordinary people, especially those who had to travel? And I'm talking about the level that may not be heightened as much when we're talking about a possible third wave. It's not really that scary as it would have been with the second wave. But when you look at the complacency of people in as far as, like you alluded to, social distancing, now I'm talking about the passion, the need to be loved, the greetings that would happen when people arrive in other provinces. The hugs, the kisses, and the handshakes, and so forth. Do you think that there would have been somewhat of a letdown?
It's interesting because the group of people we have the biggest problems with are the young, the teenagers, the 20 and 30-year-olds. Many of them believe that they won't get the disease, or if they get it, that they won't have any symptoms. So they think they are invincible. They forego social distancing, and the fact that you have very light symptoms or no symptoms at all doesn't mean that you can't spread the virus. So it's in a way a selfish thing to think only of yourself. Meanwhile, you pass it on to others who are not as lucky to cope with it as easily. So you will see already clusters of cases in our universities and places where young people gather.
There's similarly some problematic places in as far as entertainment is concerned, especially bars, taverns, nightclubs, where you see people getting closer, removing their masks when they speak to each other, and when they are on the dance floor, when they're sipping their drinks, sipping together at the table. Is there a compromise of safety protocols, seemingly?
The government has my sympathy. They are in a very difficult position because people are getting resentful at the curbing of their freedoms. And when you're speaking about these places where parties take place, there's always very loud music. So people tend to shout. And it's been shown that shouting and talking loudly and singing and heavy breathings when you're exercising, since you are dancing, exhale a lot more virus in the atmosphere. And if you are also in a place where there's not a very good air conditioning system, then I'm afraid that is a recipe for trouble.
Mm-hmm. Do you think that credit should be given to what we may have seen at face value, where in most of the churches, according to the footage that we have seen, is that some pastors at many churches were emphasizing that the congregations should sing even when they were wearing masks. Nobody should remove them at all times.
I'm afraid that masks, although it's our best defense, together with staying some distance away from people, masks are not 100% protective. So, and it's not only trying to protect you from the breath of other people, but from other people, what you inhale and what you exhale. So encouraging, I would have thought that it would perhaps be better to play a recording of a choir singing just for this Easter to get people to exhale as little as possible and spread the virus as little as possible. Unfortunately, denial is this virus's best friend. So whether you deny that it exists or whether you deny that it's going to make you sick, under those circumstances, you form a bridge and your granny gets ill and may die. So it's difficult sometimes to inspire some people to think of others as well.
So let's get to the issue of flu-like symptoms. I mean, like I've seen how temperatures vary in different provinces. Others may have traveled to high-lying areas, others to the coast, and when they come back to their workplaces, they will be coming to a warm place. So if you gauge the temperature from yesterday, all around the country, it was hot. And today, it's overcast here in Auckland Park. And that variation in temperature would also lead to what we're talking about here in as far as flu-like symptoms. Are we really facing that risk of, say, perhaps there would be flu-like symptoms that would inadvertently become COVID-19 symptoms?
The temperature within the range that you are talking about does not have a big influence on the survival of the virus, but it has an influence on our behavior. And people who find it cold outside, they tend to huddle indoors together with other people, which means that the distance between them is greatly reduced. And a lot of people have difficulty in warming their homes when it's cold. So they close all the doors and windows. So there's no fresh air, clean air, replacing the air that becomes saturated with virus. So all in all, the weather has a big influence on how many people get ill, but not directly on the virus. It has an influence on our behavior.
Dr. Bo, I don't know if you have realized that people are very cautious at first when they meet. They put on masks, sanitize, but as time goes on, they get comfortable around each other and relax and end up taking off the mask as the conversation gets heated and debates happen around the tables, especially around these gatherings where people have been sitting for more than 30 minutes and they would now say, no, I'm safe now because I think you may not have COVID-19. Is that also a caution for people to really, really be careful in as far as consistency is concerned?
You've used a very important word there. People become complacent. You know, we all get frightened in the beginning, and after a while, if it passes you by and you don't know many people who had it, then, you know, it's not really so serious. And the mask is uncomfortable and it irritates you and you can't hear properly sometimes. So you slowly, day by day, start slipping on your safety precautions a little bit and nothing happens. So tomorrow you slip a bit more. And that's the basis of human complacency. And I am really sad to tell you that I am of the opinion that I think the government and any other organization who could possibly afford it should try and encourage people a lot more to stick to the affordable, irritating but very affordable and doable control measures, that together, the distancing, the hand washing, the clean air, and the mask wearing, together, that actually really reduces cases quite dramatically.
All right. Thank you so much for making time to speak to us.
It's a pleasure.
Dr. Joe Barnes is an epidemiologist speaking to us about what to expect inadvertently in this era where people may have flu-like symptoms, and taking caution and observing all the safety protocols. Public Works Minister Patricia